In my previous video, I had spoken about HPV related cancers or cervical cancers. So I also mentioned that prevention of the cancer from occurring at all is the best thing rather than treating the cancer once it has occurred. So for this prevention, we also spoke about the vaccines. So there is something called as screening for these cancers. That is, we do certain tests in our OPD, which is just done on an outpatient department to screen. So what do you understand by this screening of cancers? So screening of cancers means that if the cancer is supposed to happen or occur later in life, so earlier itself we can see it on certain tests, like we just take certain smear or like we do some basic simple tests by which we can understand that whether the patient is screened positive or screened negative for cancers. So what do you understand by screen positive? That means that she has the risk of developing cancers in future. And if it is screen negative, then it is suggested that it is negative as of now. So she has to just repeat that screening test again and again just to see or make sure that it is negative. So there are certain again durations and number of times that we are supposed to repeat this screening tests. So this screening test can be done on every woman who is sexually active. So what do we understand by sexually active? Either post marriage or if there is any intimate relationship that has occurred. So post sexual intercourse or post sexual exposure post 30 years, we tend to, and that is she should be active sexually or married or whatever though. So after 30 years of age, we start screening the women for cancers. So that is a very simple procedure which is done on outpatient department. It does not require any anesthesia or it does not require any tools or any OT or labor rooms. It is just done an OPD procedure which is called as pap smear. So that is a simple pap smear testing which is done for cervical cancers, and I would like to suggest and advise each and every woman to consult your gynecologist for this simple pap smear screening, and also know how frequently it has to be done or the duration. Or if you have any queries, can directly message me or visit us at Meridian Genesis Center. So it's always better to screen yourself negative rather than being scared of whether I have cancer or I don't have cancer, should I undergo, should I not undergo. So rather to avoid all these things, just go a simple pap smear screening test at your gynecologist's OPD.